Hi, everyone. It's great to be here. And thank you, Becky, for inviting us to talk about, I think, Wysa. This is the third year. So I'm one of the founders of Wysa. This is, I think, the third year when we've participated in the conference, both virtually as well as in person. And I think the Wysa platform has gone from strength to strength. Becky has been, I think, a guiding light for us to think about ethics, about accessibility, about impact in the right way. I think essentially to keep us honest. And this is, I think, a chance for me to share a little bit about how the program has evolved, how the platform has evolved over the last 3 years, and also what we're seeing, I think, during the pandemic, and some of our learnings, some of our insights. And hopefully this will be useful and also spark some discussion, some conversation, and maybe some introspection on how digital mental health can be used. So I just want to spend, I think I have about 10, 15 minutes, maybe about 15 slides. So I'll just quickly go through those and look forward to your comments and I think hearing from you and maybe starting a conversation. So thank you. Let me just quickly share my screen and see if we can. So I think Wysa as a platform now is about 3 years old. And the idea behind, I think, the whole service is to scale mental health support using AI and especially around AI chat. I think during COVID and during the pandemic, we have seen, and I'm sure there's a lot of research out there and a lot of, I think, publications as well, which have come and started talking about the spike in the need in mental health support. This is, I think, data from the UK Office of National Statistics, which you can see that the level of anxiety has spiked all the way from a steady state of between April to October in the UK. And when I think COVID started happening in January, and then look at what happened in April. So 19 million people, according to the ONS, have actually suffered from anxiety now, 19 million. And interestingly, of those people who are married or in a civil relationship, which is probably the most stable set of people, according to their earlier data, anxiety levels, incidence levels are 39% in 2020, almost double that of 19% in 2019. And I think a lot of this has to do with, I think, increased pressures, the stress of juggling multiple balls, kids being at home from school, and obviously the need and the stress of actually having to keep work going as well. All this is leading to, I think, a huge amount of concern. So I think, just quick note on Wysa for people who are not familiar with the platform. It consists of three basic elements. So there is an AI chat platform where you can talk. It's an anonymous, safe space where people can talk about what's bothering them. It kind of works on the wellness end of the spectrum. And it offers an empathetic listening experience based on AI and NLP, where people can talk and the responses are clinically assured. They're developed through clinical intervention. And the entire platform, that's kind of the base of the pyramid of care. And the platform escalates, so there's an additional layer of support, which is a portfolio or a suite of self-management tools. So we have 170 different exercises, meditation, mindfulness, visualization techniques, breathing techniques. A lot of them are delivered through the conversational interface. And then there is an escalation path to a set of human support, a network of mental health professionals who provide text-based, anonymous, again, mental health support. And we can also escalate into, in some countries and with some partners, we're actually escalating to networks in country or which are available with that particular partner. This platform is being offered across both B2C and to public health provider networks, large employers, behavioral health providers, and payers. It's kind of doing three different things. It is helping people assess the need and understand who's needing more advanced support versus who needs self-management support, signposting and escalating, creating a custom care pathway where you can then take people onto different types of services which might be available either in the public health agency like the NHS or a large payer. And for the people who don't meet threshold criteria for inclusion into advanced services or for therapy, then you can provide basic self-management support. So we've been around, as I said, for 3 years. We're probably one of the largest in the world today in this particular space. So 2.1 million users, more than 100 million conversations. I think last counted was, I think that, but we are rapidly losing count. And available across 60 different countries. Wherever there is a Google Play Store or an Apple App Store, you can download the app and you can use it. Interestingly, 40%, so a large percentage of our user base is coming from the US, UK, and Canada. And then you have a large percentage from Southeast Asia or Asia, as well as India. We're done, I think we track, a lot of people ask us what's the kind of impact this has had. And if you think about restructuring thoughts to drive emotions and how people can construct breakthroughs on those, we've done 1 million breakthroughs, cognitive restructuring breakthroughs last year. And some people tell us it sometimes takes 3 hours of therapy to get to that point in certain use cases. So I'm not suggesting that this can replace therapy, but saying this can be an adjunct, and you can actually provide a benefit like this through an automated platform, which could be very, very high, and it could replace a lot of human effort, and which I think is really significant. For example, just to give you an idea, we've served 2.1 million users with a 40-45 people team. So that's the kind of scalability of the model. Over the last 3 years, it has been rated by Orca in the UK. Those people who are in the UK know how significant that is. So we've been rated at 90%, which is the highest across all categories, not just mental health, with 100% on clinical assurance. We are the top digital mental health intervention, being now used across multiple trusts in the NHS, and also been rated as the top for self-management during COVID. Google has, I think, rated this and featured Wysa as the top mental health app globally on World Mental Health Day in 2 successive years. We're part of lots of, I think, very interesting and selective accelerator programs, and we've also published some proof of efficacy and outcomes in peer-reviewed journals. So let me talk a little bit about what we're seeing during COVID. So as expected, and I think this is data drawn from our own records. So we've seen nearly a doubling of people during lockdown, February to July 2020. We saw nearly, I think it was close to 600,000 people who sought help, who downloaded. So these are new users. So we're adding maybe more than 3,000 people a day. And this is double what we saw same period last year. And this is all organic. It is search-driven, referral-driven, where people are proactively looking for help and finding Wysa and using it. So I think this is a very data-packed view of what people are really doing. They are coming and they are taking help. People are also liking what they're seeing. I think the fact that it has, you have some basic self-management, which is always on, has actually really provided, I think, a lot of comfort. And especially where I think, as you can see in this user review, you can see that there were people who are now suffering from lack of access because they can't leave home, social isolation, quarantining, and so on. So you do need, I think, in situations like this, a remotely available mental health service. And this, I think, is an example of a user who would like the experience. We released some pandemic anxiety tools. I think I'll talk about that a little bit later on in the presentation, and where the year we launched, they shot to the top. As you can expect, there was a huge amount of demand and people started using them, and they've kind of stayed in that top 1 or 2 out of the entire 170 different exercises. Our exercises which are related to pandemic anxiety have stayed at the top. So there is clearly a need, and it is being, I think the service is being used by people who are specifically in that particular situation during COVID. This is another, I think, much more stronger review where it's about this young, probably school-going person who has suffered from social isolation, stayed at home, and I think that just again the anonymous safe space which Wysa has created has, I think, had an outsized impact. And along with he or she talks about negative voice in my head, shut up, and positive voice became stronger. I think a lot of the restructuring exercises which we have on the platform have clearly had an impact. And although we say that this is not a crisis support app and we have very strong escalation paths into SOS helplines, they're also saying that there were certain suicidal thoughts which I think Wysa helped them overcome, which I think is amazing. And we've had multiple people who've come to us and written to us saying that this has actually helped save their life. So we are very grateful, I think, for the kind of impact this has had. So what are people coming to Wysa for, especially during this time, during COVID? We went back and asked our own mental health, our coaches, our therapists, and said, what do people talk about? And I think this is probably not news to people who are seeing this. A lot of it is around sleep and eating disturbances, loneliness, and loss of routines. Unfortunately and tragically, sometimes bereavement, and I think nervousness on access to care, both mental and physical. Um, Jobs and financial stress is a huge one, especially with the ups and downs in the stock market over the last few months. This has come out as a very big area of concern. Health anxiety and unhealthy coping strategies around addiction gaming. There are other things around sleep and domestic abuse, alcohol, usage of alcohol. So those, I think you can, we read about these, I think in the literature, in surveys, in the popular press. We are seeing this in our own data as well. I think more interestingly, what is helping? So again, we went back and spoke to our therapists and said, what do clients or what do users like, and how are they helped? I think it is more about creating the awareness, being mindful of what is under their control and what is not, gaining that perspective, gaining an ability to celebrate small victories and quick victories rather than holding out and hoping for things to get better. Um, any support around routines, better sleep, eating, and I think overall generally a lack, I think ability to manage that loneliness, the fact that you can unlimited messaging is available, there's a coach on call remotely where you don't have to leave home, I think really helps. And especially around strategies and exercises or techniques which have helped: grounding, breathing exercises, and cognitive restructuring. I think these are the things which our coaches and therapists tell us have been working with clients. We've also, I think, seen a very interesting shift, and I think a huge amount of interest and I think speed on providers. So this is an example of some work which we've done with Cincinnati Children's Hospital in the US. I think one of the leading pediatric hospitals in the US, where they worked, or we worked with them, with their clinical clinicians and psychologists and psychiatrists, and created a specific module on COVID anxiety. So using a lot of the techniques and exercises we already had built on Wysa, we've created a pack, a COVID anxiety pack. We were able to do this in 5 weeks, given the urgency, and I think the team there was fantastic, and everybody kind of all hands to deck, and just we pushed this out in 5 weeks from start to finish, and it has received really good patient reviews. I think when this probably is a model for more in terms of for a digital health provider, this is probably a great collaboration model where you can start working with clinicians, with providers, or with people who have deeper clinical expertise, and co-develop stuff together. And this probably is a sign of things to come, where a lot more of this collaboration will start happening, and we can hit the market faster in a time of greater need. There's also been, I think, public policy and investment changes we've seen. So Innovate UK has released a challenge around, I think, offering support during COVID. And, we won a grant to offer support during adolescence, which is now currently rolling out. So we started working with some schools in the UK now to offer this as adolescent support. And interestingly, even I think private players, people like large payer systems, and health plan providers, people like Aetna International, which is the private medical insurance arm, came out and said, look, we can see the second wave happening. We can see the impact on mental health. And this is something which we need to create and offer as a service or as a benefit to our members. And interestingly, working with a payer typically takes about a year to get into the system and complete all their risk approvals and infosec review. We did the entire thing, including contracting and review and approvals, the whole, and the product development in, I think, 7 weeks, 7 or 8 weeks. That was the speed at which this happened. So I think the system is responding to the need, and various people, so whether it's funding, whether it's providers or clinicians working together with digital health providers, or it is payers and health plans, I think there is this sense of momentum which we are seeing, and we just hope that this continues, because really in this time during COVID, you do need a digital mental health strategy. If not now, then when? So thank you. I think it's been great. I'm very sorry I'm not possible to be there in person, but thank you for the opportunity to talk about what the work we're doing. Hopefully this was useful, and that's my email at the bottom, and look forward to hearing from you.